Hi, Dr. Mark Agresti. I want to talk a little bit about addiction. What does it mean to be addicted? Psychiatrists call it substance use disorder, but that's too hard to say, so I'm going to use the word addicted. Now, let's talk about what addiction's not. Everyone comes in and says, well, I'm not an addict because I don't use every day. That's not a criteria. I'm not an addict because I don't use a lot. The amount, the intervals you use on, whether you use once a day, once a week, once a month, that doesn't mean you're addicted or not. Whether you have withdrawal or not, that doesn't mean you're addicted or not. Just because someone has a withdrawal from a drug or some substance doesn't mean they're addicted. So you could have a withdrawal and still be not addicted. So when, where, and how you use a drug does not mean you're addicted. And a lot of people use this as a rationalization. Well, I don't use a lot. I don't use every day. I don't have withdrawal. I only use around friends, or I only use on the weekends, or I never shoot it, I snort it, or I smoke it, I never drink it, blah, 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 blah. So these are all rationalizations that people use, and I'm not buying it, people. No, 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 no. These are what people come in my office, they tell me, oh, I'm not addicted because of this or that. No, I'll tell you what. I ask myself, well, how are things going with your family? Has anyone in your family, brother, sister, mother, father, girlfriend, child, complained about your drinking, smoking, taking pills, about how you're nodding out, or you get drunk and go into blackouts and can't remember the Thanksgiving dinner, or how you change when you use drugs? Has anyone in the family complained? Well, if they have, you probably have a problem, right? That's a big criteria. Has anyone close to you said, you have a problem? Your friends, family said, yeah, you acted like a complete idiot, at dinner. Or, you lost your composure, you became agitated, or you didn't seem to be present. And it doesn't matter how many times that happens. If it does happen, there's a substance abuse problem. There's another criteria. Do you drink? Do you smoke? Do you snort? Do you shoot? In spite of it hurting your body. Maybe it alters your personality, alters your memory, alters your learning, alters your decision-making ability, alters your motivation, alters your sleep, alters your eating, changes your regular exercise routine. Uh, Maybe it puts on weight. Maybe it causes weight loss. Maybe it has visual problems. Maybe it has liver problems. You know when something is affecting your body in a negative way. If you're using a substance, in spite of you knowing it's affecting your body in a negative way, you have a problem. Big problem. Big problem. Now, what about your job? Are you having job performance issues because of a substance? Coming in late, coming in when you're foggy, missing work, being on the job absent, making poor decisions at work, making errors at work, not getting the appropriate advancements, and stagnating at work. These could be related to drugs. So to summarize here, friends and family complain due to your substances, you probably have a drug problem. You hurt your body, well, you probably have a drug problem. You have job problems. What are the other issues that could happen? Legal problems, DUIs, possession charges, consequences from using in the legal system. Has that been an issue? Well, then, if it has, you probably have a problem. There's another one, financial. Are you spending, and finances go in time and money. Are you wasting too much time and money using a drug where it's hurting your finances? So any one of these categories could be an issue, right? Friends and family, body, job, legal, time and money. So 1, 2, 3, 4, 5 things. That's how we determine if someone has an addiction problem. Hopefully this video helps and will sort of demystify all the what people say to rationalize in their mind. And they say, well, these are the reasons I'm not an addict. And I'm telling you the reasons you are. So if you don't fall under any of these 5 categories, you're probably not. But if you do, hello, you may have a problem. Bye.